All right. Hello, and welcome to our presentation. We're going to be talking today about implementing agency changes for access to electronic medical records at Guardian Healthcare in Fairmont, West Virginia. This project will be completed by myself, Jessica Paskis, Cameron Garza, Jenny Burrows, and Madison Iyer. All right, next slide, please. Okay, thank you. Okay, so what are we doing at Guardian Healthcare? First off, let's start by talking a little bit about Guardian Healthcare and the changes being made to the information health system and the electronic health record, which will allow our patients to have greater access to their electronic medical records or EMRs. Guardian Healthcare is a rehabilitation center in Fairmont, West Virginia, and it provides post-acute, short and long-term, and skilled nursing care services to residents in Marion County, West Virginia. We are implementing this new service through our electronic health record, or EHR, system at Guardian, which will give patients the access needed to view their electronic medical record, or EMR, from a QR code or a personal account. Just a little bit more background information about Guardian Healthcare. It is also a healthcare staffing agency, which is an organization that specializes in recruiting, hiring, and onboarding talent, organizations like hospitals, clinics, and other medical facilities. And the importance of understanding this is to help us understand that implementing these changes is going to be viewed not only with our residents, but all facets of the agency. Next slide, please. So we are going to be implementing a new service through the electronic health record. Um, Before we explain further about this, let's talk a little bit about an electronic health record and an electronic medical record and what they are. So, what are they anyways? An electronic health record is a culmination of a patient's medical records and other health and related information gathered by the agency on file for a given patient. Electronic health records come from multiple healthcare providers and give a comprehensive view of the individual receiving services. On the other hand, an electronic medical record, or EMR, is an electronic version of medical records like lab results and other clinician notes. So, understanding this, the EHR and the EMR go hand in hand. They are a part of the same system, which is the health information system that is used by Guardian Healthcare. So now let's focus on what an EMR can be used for by our agency. It allows employees to track data over time about our patients. It also allows our employees to easily identify which patients need preventative screenings or checkups or other services through our agency and other medical facilities as well. It allows us to check on our patients' statuses through looking at certain parameters of their health, things like blood pressure or vaccinations or even blood glucose levels. Um, the electronic medical record also allows our employees to monitor and improve our overall quality of care within the practice through using a little bit of quality assurance. So, when we think about this, we understand that this is a comprehensive way for us to gather more information about our patients and have better communication between our agency and our patients as well. Next slide, please. So, how are we doing this? Now that we understand the components and the uses of the medical record and the electronic health record, let's talk about how we will make these changes. So, we are creating a process throughout our health information system to allow electronic medical records to be viewed independently by patients. And these patients will be able to access their own medical records through their personal accounts on their personal devices, or eventually through a QR code. So, to make these changes to our system, we are going to be using the waterfall method. And this is a traditional approach to information systems development, which is something that will be going on while we are adding this new service for our patients. It's going to require that each phase of change that we make to our electronic health record system is going to be completed before we work on the next stage. So, using this method, it's going to give us the opportunity to work out the bugs, work out the issues that we see upon giving patients access to have their own personal accounts and set those up. Um, and before doing anything else. So, understanding that, right, is where that's where the employees are going to have to come in. So, we're going to be rolling out changes phase by phase and begin with the creation of personal accounts. Once this step is completed, our clients will be able to access their EMRs through their accounts and from their personal devices. During this step, employees may need to, or actually most likely will need to, assist our patients and their families in creating personal accounts and answer any questions about the process that our patients and their families have. After this goes into place and we have worked out all of the bugs, we are going to work towards implementing the use of QR codes to simplify the EMR access process. So once we have our personal accounts in place, the QR code gives us the opportunity to view the electronic medical record on their personal device instantly by pulling it up through a link. This process is also going to require some guidance from our employees and from our staff to our patients, as this is a new process and it could be a little bit confusing at times, especially to some of our clients who may not know how to create a personal account. But just remember that with this process, it is a work in progress. There's going to be bumps in the road, but by using the waterfall method, we are going to ensure as much cohesion and implementation as intended before we move on to the next step. And after this is all over, we will have all of the processes in place that we have discussed in this training. Okay, next.
So now we're going to talk about the need for implementation of the QR codes for patient documents. And there are four main needs when it comes to implementation, and that's having accurate and up-to-date data. Nope, up-to-date patient information. It saves time at the check-in and checkout desk and that whole process. Easier access to patient records and sharing of medical records with other healthcare professionals. So when it comes to having accurate and up-to-date patient information, then patients can quickly view paperwork and let their provider know if something is incorrect instead of having to wait for someone to print or fax those papers off. And obviously that can be very time consuming. It can, and again, that will just save time during the whole process. Um, when And many patients also have mentioned throughout their time at our facility that they feel like they're being just kind of led around in circles and going back and forth. And this will help kind of eliminate and alleviate that feeling that they're having with their documents and records. And again, the QR code will just make that easier for them. And the patients that the and then the patients will have easier access to their documents, which again, like I mentioned earlier, instead of waiting for someone to fax or email the records to a healthcare professional if needed, then they already have those documents with them and available to them so they can easily share those documents. So then for training strategies and procedures as we roll this out, um, the first one is the super user training, and this kind of gives certain employees, this trains certain employees that will be able to help other staff members. So a group of employees are kind of like the test subjects, for lack of a better term, and they're trained ahead of time so they will be able to show other employees the tips and tricks and kind of how to quickly move through it instead of everyone learning at the exact same time and trying to figure it out together. It might be easier for some people coming from another staff member versus coming from a boss or someone that they're not as familiar with. For the role-based training, it is specialized for the roles of the employees. So we would break employees up into different groups based on their roles and responsibilities in the with what they do at the facility. So based on what their roles and responsibilities are, they'll be in a group. So the receptionists will all be in a group together and so on and so forth. And that will again help show what procedures and strategies when learning this new technology and tools, how that will best support their duties with the new system. And then the process-based training is understanding a new workflow. So that'll kind of help the users on how to use on how the practice will best provide those new systems for our patients.
Some considerations for rural communities. So they may have people living in rural communities may have unreliable access to the internet. This can make it more difficult for them to access these medical records electronically. Limited access to local IT support is another thing to consider. Issues with like electronic record systems are bound to happen. Not having local IT support can cause these issues to take longer to fix. And they could have IT support provided over the internet from another company, but this can sometimes be expensive, especially for smaller practices. Um, People living in these communities may not be as familiar with technology, and they may not feel as comfortable using it, and can be resistant to change. People aren't always comfortable with change, especially if there's, a certain way they like to do things or that they've always done things. We see this a lot in rural communities and from older adults. Families may not also fully understand how to access these electronic records, which can lessen the benefit of them. We can still have employees help show the families, but that doesn't always mean that they'll remember how to use it, especially when they get home or something. And then, or they may not want to learn how to access the information electronically and may prefer the information on paper. I know, for example, my grandmother does not know and does not want to learn how to access her medical records electronically and prefers everything on paper. And then they're also at risk for data breaches, like due to lack of security measures. They often don't have as good of malware protection against hackers, which can cause residents' medical records to be more at risk. Next slide. Thank you. And then some administration practice issues. Some staff members may be resistant or uncomfortable with the change. Once again, people don't always like change, and this includes the staff. Um, some people working in a nursing home may have been working there for several years, and have a system of how they like to file the documents and complete assessments. And this would change the way they do things, which they may not always feel comfortable with. Um, and then existing paper-based records would need to be uploaded to the new system, which can be time-consuming and leave room for human error. It's very important to have residents' medical records all in one place. You can't have like half the medical records, electronic and the other half on paper. And this means during the implementation of the electronic record system, all the residents' existing medical information would have to be uploaded to this new electronic record system. This not only is time consuming, but it also leaves room for mistakes due to human error. Um, and then implementation can be costly. So IT support is very important. They would need to have IT support in place because there is bound to be a bug, especially like in the beginning. And it's important to get these issues fixed as soon as possible. Trainings would be required, and employees would need to be paid for this training. Some employers do provide lunch during these trainings, which can be another added expense. And then updates. Expect every electronic system would need to be updated and maintained. Some systems require companies to pay for updates to continue using these platforms, which can be another routine expense. And then they also have to have a plan in case of an emergency. So emergencies happen, and it's important to make sure that, they have a plan in case one does happen, like if the power was to go out and the electronic system would be down. They would still need to have copies of these residents' medical records on file to ensure that the residents are still receiving the proper care. Um, Things like, what medications the resident takes or what their code status is are very important to have easily accessible during an emergency. Next slide, thank you.
So I'm going to be going over the National Association of Social Work Ethics and the importance of implementing these values into the EMR system. So I want to start out by saying that it's important when using electronic medical records that we as an agency at Guardian Healthcare are providing ethical and confidential services to clients. So in general, client records should be reflective of accurate information in terms of cost, about what services we provide, and a breakdown of what exactly was done with that client. Examples would include like outpatient therapy, helping a client bathe, what medications were given, during what time, nursing checks, and so on. The NASW Code of Ethics outlines the importance that notes are completed on time. The NASW Code of Ethics generally recommends giving employees 48 hours to complete their notes. We can implement at the Ethical Standard 3.0 for client records by creating or editing an agency-wide policy addressing the importance of completing notes within 48 hours. Information should be updated relevant to this new policy. The employee handbook and new job responsibilities should be added. For example, the documentation that needs to be completed within 48 hours should be signed by employees that are already there, and then having a new handbook for new employees coming in with the 48-hour need for 48-hour documentation outlined in that employee handbook. Now, in terms of electronic and cash payments that consumers are paying for at Guardian Healthcare, it's recommended that cloud servers be used to provide the service. Cloud servers are basically sites that all employees can access to create and edit records of the clients or consumers, including their profile or personal information. Most places have something similar to a cloud server. It is also important to implement firewalls to protect against privacy breaches and any computer data that is collected. We can implement this by using Adobe, a trusted server. And I just want to go over in general what makes Adobe a trusted server. First, we want to look at the amount of time it's been around and the reviews that have been provided by other organizations. Adobe has been around for a pretty long time and has pretty good reviews, but we could use really any trusted server at Guardian Healthcare. And then it's also important to note that social workers utilize confidentiality measures by the use of HIPAA in notes because the Guardian provides long-term care. We should be storing these notes for approximately 10 years, according to West Virginia law. Now, in terms of storing the data, we could store it by paper or in a computer system. I think most days now, most organizations are using a computer system to store that data. It's also important to consider what information we are providing with the QR code that we're going to be implementing. Documents that are scanned into the QR code should be blank, or the QR code we could link the QR code to a user password that allows the consumers or clients to log in to access the medical records. There's a couple ways we could do it. We may also consider using a backup site that basically a backup cloud server to prevent agency data loss. So basically what that would do is we wouldn't use it primarily to put our notes in, but it would be like a backup type prevention of loss. We also could purchase insurance to protect against data loss. Next slide, please. And then I want to go over cultural competence. First, I think we need to identify the population we're working with, which includes the elderly, sick, and disabled population. We really want to prevent discrimination, racism, and cultural divide at as social workers. And we can do this, in a variety of ways. Firstly, it's important to address clients with the proper pronouns, using client-centered language, and being accepting of client wishes. Some elderly may not want to participate in EMR, and we must respect their wishes, as it's important to have informed consent, as outlined in the NASW Code of Ethics. We also need to be mindful of our unconscious biases and respect clients' cultures and embrace diversity, and ensure all clients have equal access to resources. We can ensure quality assurance by using evidence-based practices, continually providing trainings for the most effective ways to provide care to our employees, and ethically providing data and statistics relevant to further studies. An example of this would be using SAMHSA, obtaining a grant from SAMHSA and collecting data ethically to provide future statistics for studies. That way, we're kind of giving back as social workers in an ethical way. And then lastly, we can assure quality assurance by providing feedback to employees. And we can do this in supervision, meeting with your supervisor weekly, bi-weekly, that kind of thing. And then, as I mentioned earlier, providing trainings to our employees to make sure that we're doing up-to-date things. And yeah, that is ensuring cultural competence and quality assurance.
So we want to take some time to thank everybody for participating in this training and listening to this conversation about how we are going to implement changes at Guardian Healthcare. There will be a discussion question to follow along with our presentation if you want to take a look at that in the comments, and definitely start some conversation about EHR system implementation. So again, thank you so much for listening into this presentation, and have a great afternoon.